Hello and welcome to Got Clutter. Get organized the conversation. I'm excited because I have Dr. Deborah Roebuck, the Menopause Whisperer, here with us today. And as you know, all the month of October, I am focusing on breast cancer awareness. So, Dr. Deborah, thank you so much for joining us.
And I thank you too.
So, I would like for us just to start the conversation with your breast cancer journey.
Well, let me tell you, first and foremost, I will encourage people. Okay, you do your breast exam. You don't think anything is wrong. I went to my GYN doctor, she did the breast exam. Oh, everything's all right. But I had made a commitment to myself. Every year I was going to get my mammogram. So 2 months later, I went to do my mammogram. I thought, okay, I got everything to do today. I'm on out of here. Girl, they said, Mrs. Roebuck, can we speak to you in the room for a minute? And I said, oh, okay. I went in the room. They said, when we did your mammogram, we found something. And if it's all right with you, can we do an ultrasound? I mean, we're not trying to pressure you. And I will tell people, say yes if they want to do further testing. I did the further testing, and then they did further testing. And then they said, we definitely see something. We would like to do a biopsy. And I'm thinking, I don't have any family history. I never had no issues. I said, fine. I had the biopsy, got a phone call coming out of the Y in my car, and the doctor said, you definitely have breast cancer, and we need you to come in as soon as possible. Now, I'm going to tell you the truth. I am so thankful that I went through the process because getting a mammogram is the most distinctive way to be able to identify what you have and what you do not have. And so I encourage everybody, especially because mammogram day is on October the 16th. And that is important. So, and especially because of the pandemic, they said the normal screening rate has gone down by 60% of people over the years had said, oh no, I'll get it another time. And they had put it off for too long. And so, what needs to be done? Call your doctor, schedule your appointment, and at least that way you can have peace of mind about your breast status.
Mhm. So, Dr. Deborah, is there a relationship, because you're the menopause whisperer,
Yes.
between menopause and breast cancer?
Well, I've done additional studies around that because a lot of times women will say to you, well, I'm a certain age, I don't have my period, I don't need to do this. No, as you get older, the risk of having breast cancer becomes even more prevalent. So I will tell women, yes, 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 get your mammogram. But I will also say to them, there are other risk factors. Being African American, women are
Mm.
more at risk. It's not so much as them identifying it, but identifying it too late. And the major thing we want women to do is identify if they have breast cancer early. Because if it's identified early, then you have a greater opportunity to handle the issue and increase your quality of life and your mortality.
Mm.
Also, if you have, I think it's BRCA, I forgot the whole term. I should have that together right now. But if you have a genetic risk factor, then make sure you get your mammogram. They tell women who are extra weight, make sure you get your mammogram. If they said to you, you have dense breasts, go ahead and ask them, well, did you do an ultrasound? I want further clarification. And in many of the states, they almost mandate it. You have dense breasts, you get your mammogram, you get an ultrasound to go along with it. So that's what's going on in the relationship between menopause and also breast cancer. Because as you get older, the incidence increases.
Mm. And I'm so glad you talked about the dense breast, because I remember one time I went for an exam. They
Mm-hmm.
said they saw something. I went again. And then they wanted me to go to a specialist. And I just, like you said, I just kept going. I guess just kept saying yes. They eventually said, Janet, we don't see anything. We want you to come back in a year. But if you have any problems or anything, you just connect with us. And I think that's important too. And also what you were saying about how many, the percentage of women who are not getting these exams. I have a buddy. So we just kind of check on each other. Did you get your test? And I'll say, yes, I scheduled it. So yes, those are important. So, as the menopause whisperer expert, what are some things that maybe women can do? Because, I want to take the opportunity to find out, because I know I'm going through menopause, of just some things that we can maybe do to either manage with menopause, eat healthy. What are some things that we can do?
Oh, well, let me just tell you, I talk about this topic all the time. They're basic health promotion and health prevention things that we can do as far as our lifestyle is concerned. First and foremost, take health responsibility. I'm talking about when it comes to your health. I talk to women, they say, well, I have hot flashes. My first question, did you go to your healthcare provider? Oh no, I don't think they would talk to me about. No, no, you are the manager of your health. You talk to your health provider. If you don't feel like you're getting the right answers, go to somebody else until you get the answer. The next thing is exercise. Especially when women talk about, I'm so moody, I'm grumpy, and everybody get on my nerves. I said, if you do exercise, it increases the endorphins and it helps mellow you out. Those are the things. What you eat. Now, people, I'm going to tell you the truth. I love chocolate. But I talked to too many women. They said, I know when I have that increased caffeine, candy, all those things, I'm going to be having some hot flashes. Okay, so let's look at your diet. What things are triggering? What things will decrease? Another thing, sleep. Sleep is so important, your sleep health. How do you get ready for sleep at night? Now, women will say to me, I wake up in the middle of the night and all of a sudden I'm drenched. That is a night sweats. Difference between hot flashes and night sweat. Night sweats will wake you up out of your sleep and it's even more intense. So let's look at all the triggers, the things that accelerate these various different things. Another thing is during menopause, relationships. Now you'll say, now what does that got to do with anything? And the same thing when it comes to breast cancer. Your companion. You said about your accountability buddy. Okay, do you have somebody you could talk to? We have whispered about menopause and breast cancer too long. Let's be vocal. Let's say, sister girl, what are you doing? Even when I had to go and get a decide about a doctor, I talked to all the people I knew and got their assessment, got their reviews, and that's how I made my decision as far as who I'm going to. And then why do you go to the doctor? I'm talking relationships by yourself.
Mm.
I've been a nurse since 1976. Now you think I'm supposed to know something, okay? But when it's about you, you better have some other ears. So the doctors, the whole time they said, I know you don't come by yourself. Did you bring your executive board with you? I said, yes, they're outside. So I had my sister-in-law, and a good friend. Each one of them had a role. And you should have that as far as menopause. Who around you is the person that's going to say, girl, did you do A, B, and C? Who's the person that's going to nurture you and just love and dove on you? Who's the person who's going to find the scientific facts for you? You cannot live this by yourself. Why you got to be, oh, I just gonna suffer by myself? Oh, that's crazy. No, no. You get your crew around you and let your crew hold you accountable. Be it breast cancer, be it menopause. The other thing too is stress management. They have shown increased stress, hot flashes. Now, at this time in life, you don't have the patience you used to have, but even more, everybody wants something from you. As I said to Jen before I came on, I had 5 phone calls before I even came on to this. Everybody want a piece of you. Well, I'm going to tell you something. You got to put some barriers up. And I'll tell you, a couple of those phone calls I chose not to answer because I had to set priorities. And your one priority is taking care of yourself. If you don't, you're working on empty. And then nobody's going to get anything from you.
Oh,
So those are some of the things I say, and I work with women around, because at this time in life, Janet, I found out, as far as the workforce is concerned, according to Forbes, we are 26% of the workforce. Now, is that not a lot of people?
wow.
So it's time to be heard, because even during the pandemic, it's the women who were menopausal. We were sandwiched between everybody. If it wasn't the younger people and we taking care of their kids and doing 50 million other things, it was the people who are older than us, and we're taking care of all their issues. And nobody cared about menopause. They didn't care we were menopausal. Gimme, gimme, gimme. Because we got the brain trust. We're the wise women at this point in life. So
And
let's be
that's
wise
true.
about ourselves, okay?
And that is true. And I like the way you said that you have like your board. It's like your health board because everybody has their role. And I think that's important because I think those people help us stay accountable. I've got
Yes.
two people. One person is always like, okay, did you go to your doctor? Blah, blah, blah. The other person, okay, what did the doctor say? And then,
Yes.
and I also had that person, even if I'm not feeling well or whatever, she'll call, okay, you need to do this. And you know what, Dr. Deborah, I do it because I'm afraid,
Absolutely.
okay, she's going to show up at my door and I don't want that to happen. So you're right.
Absolutely.
And also
Absolutely.
and also one thing I started doing like over a couple of years ago is every time I had my annuals before, I would go sit down with the doctor and she's like, okay, I want these series of blood tests. And
Hmm.
then we play phone tag afterwards. Now I ask her, can we schedule them before so that they're already there when I have my appointment and we can discuss what's going on. And then if I need to do something, you can tell me without all this phone tag kind of stuff. So that's something.
Let me tell you something. You are so on cue. I had a friend who has a major disease. And she says, Deborah, they won't let you come with me but my son. So what I did, and this is wild and crazy, of course, I'm a healthcare person. I went in Chat GPT and I typed in there, my friend is going to the doctors. I want the doctors to ask, what is her status? What is her diagnosis? What is her future? Girl, we had 5 pages. She went to the doctor yesterday, and the doctor, she said, do you mind if I ask you questions? Okay, we're going to ask. Whipped out her paper and went step by step, her son taking the notes, and then the doctor said, how you get all these questions here? Now, the thing that made it so fantastic, Janice, is all this time, we're talking 4 or 5 years of her not understanding
Mm,
anything.
mm,
And the time she left out of there, she called me. She said, I am excited because he told me he's going to do this, this, and this. I was going to get this, this, and this. If you're not prepared, when you go to that doctor, they only given 10 minutes to talk to you.
that's
Even if
true.
you have to send your questions through the different resources they have, so they can be ready, so y'all can use your time and their time to the best of
Mm.
everybody and get some results.
Wow, that is wonderful, Dr. Deborah. Well, I was going to ask you, did you have any inspirational, something you wanted just to say, just to encourage women? I mean, you said so much, but just to encourage them, one, to get their breast exam, but also to stay on top of menopause.
I want them to know that this is going to be the most fantastic part of your life. You are leaving your legacy. And a lot of times women will say, oh, I got to shut down. I'm this, I'm that. No, let's change that mind. Let's rethink this. Okay, I don't have a period. I got to worry about this and this and this. So, how am I going to leave my mark on this earth? So when I'm no longer here, I'm still radiating my brilliance. And that's what I tell them. Take this time to work on this. These signs and symptoms, let's work on them right now. I'm putting together every month for the next 6 months classes about each and every symptom. My first one is I'm tired of being hot and sweaty. So I'm bringing a group of women in, And I'm also then doing a whole video course. So then they could go back, look at it, have the resources and what have you. Let me tell you, we got to make our mark. We show people how to treat us. And if
Mm.
we don't have the information and the resources, well, they're going to think we really don't care. And right now, this is something I really am excited about and I'm doing. And I tell people just go on my website, going through the
Mhm.
change through THRU, thechange.com, and click on it and find out information about it. That's what I'm here for.
And I was going to tell you, please give the listeners your websites and of those watching so they can connect with you and well as sign up for your classes. Of course, I'm getting ready to use my voice. So I think it's time for me to end here. But thank you so much, Dr. Deborah, for your time. Thank those of you who are watching. And of course, make sure you visit our website because I will have all the information in the show notes.
Okay. Thank you so much.